My name is Martin Lawrence Dresner, and I'm a urologist. I don't really care. I have friends who still call me Colonel from my Army days. I have some people who've not even been in the service, but they know that I'm a Colonel and they call me Colonel. Some people call me Doctor. My nickname in Tucson is Dr. Jazz, and a lot of people call me that, and I answer to everything. I was at the VA in Tucson for 22 years and ran the urology program the entire time. And there was a period of just under 10 years that I was chief of the Department of Surgery. It was a great honor. I was very pleased with it, and there have been a few somewhat similar feelings I've had over the years. My college, Ursinus College, awarded me the Laughlin Educator Award a few years ago as well. And the Society of Government Services Urologists awarded me not only an honorary lifetime membership that was last year, but about 15 years ago, they gave me the H.G. Stevenson Award, which is a Lifetime Achievement Award. I was very pleased with that. I was in Vietnam from 1966 to 1967 for a year, basically. And while I was there, I went to jump school and got American airborne wings. And I also jumped with a Vietnamese jump master and got Vietnamese Special Forces wings. I was awarded the Bronze Star for Meritorious Service, an Air Medal, the Vietnam Service Medal, and the Vietnam Campaign Medal. I had two stars on my service medal. Subsequently in the Army, I also was given the A prefix, which denotes professorial status, and I was given the Order of Military Medical Merit, and the Legion of Merit was given to me when I retired from the Army. There was one other significant award. When I was in Vietnam, I got the Combat Medical Badge. Absolutely not. I considered myself the least military person that I knew. I didn't really know anything about the military until I was drafted. But when I was in the military, I realized that these were mainly good, patriotic people and that they deserved good medical care, and I decided to make that my mission. And that's what I did until I retired in 1994. The most satisfying thing, excuse me, is the patients are generally wonderful. And one of the good things about urologic patients is that except for the bladder cancer patients who are typically cigarette smokers, most of my patients are innocent. They're not responsible for their disease, and they're generally extremely grateful, and I have a really good opportunity to help them. And that's one of the reasons I chose urology. Well, we made some huge advances, and there are some areas in which I would have thought we would have made advances 50 years ago, but in fact we haven't. The areas that we made great advances would be, for example, the treatment of testicular cancer, which is a cancer in young males. And when I say young, it's from puberty to 40. And the chemotherapy that we now have is so much more effective that very few patients die of their disease anymore. A good example of that would be Lance Armstrong, who would have died for sure in the 60s before we had adequate chemotherapy, but he survived with all those metastatic areas that he had. It was just unbelievable in the past, but that's the way things are today. We've made huge advances in Wilms tumor, which is a kidney cancer in children. The standard kidney cancer in adults is now generally picked up incidentally on imaging studies that are done for another reason. And those patients that used to present with symptoms did far worse than the patients today who are picked up incidentally. So we're getting the kidney cancer way earlier than we used to, and the survival rate is much better. But for example, I would have thought 50 years ago that eventually we would have a good drug for prostate cancer, and I've been waiting for it all my life, and we still don't have it. So the other huge advance that has been made has been the institution of minimally invasive surgery. And the video camera and the use of minimally invasive surgery has just changed almost everything that we do. I wouldn't change much. I love the work that I do, and so I would be a physician and I would be a urologist. I love the fact that I can help people, and that the patients generally are really nice people who are not responsible for their own disease. The computer has really changed things remarkably. It has made case logs and things like that much easier to retrieve and to make accurate. But probably the bigger thing is having a medical record with everything in it, and you can find it, which is so much better than the old handwritten record, which I gave up in 1973. I've typewritten all my notes since 1973. So I went from a manual typewriter to the Selectric, and then the Selectric 3. I thought I was in hog heaven, and then eventually to a computerized record. And it's just so much better for having the information and having it easily retrievable and legible. Well, I don't seek any advice anymore as far as my business is concerned, because I'm retired. But I still attend a conference at the university every Wednesday morning, and we discuss interesting and difficult cases. And if I ever had a problem, I would always be willing to discuss it with my colleagues. Well, absolutely. I mean, one of the reasons for being in the Army and one of the reasons for working at the VA is not having to deal with the patient's ability to pay for his care. And to me, that's a huge issue because I feel that people are deserving of care. And very frequently, the people who need the care the most are the people who don't have the wherewithal. Well, all you can do is try to do the best job you can and make sure that the patient is getting the care that he or she needs. When it comes to the other aspects of it, the finances and the living and so forth, then we depend upon social workers to do their best. And sometimes there are no good answers. Thank you very much for watching. I've enjoyed sharing this time with you. As a person who's now elevated in age, one of the things that I've done over the years is I've tried very hard to make sure that patients who undergo surgery don't have to experience pain. And yet, at the same time, I keep my use of opioids down to a minimum for several reasons. One of them is, of course, the possibility of addiction, but another is that the opioids tend to put the gastrointestinal tract on vacation, and that's not good. The other thing that I have done is tell all of my older patients that they can now stop worrying about home invasion and terrorism and carjacking. What they need to worry about is falling, because falling is one of the things that frequently leads to either a huge reduction in mobility or death. And so I do these things myself. If you're my age, you should have a hand on the railing when you're on the stairs, and if you're my age, you should never be on a ladder for any reason. So these are things that I espouse to my patients in addition to their urologic problems.